Please welcome the panel on disability data justice in a global context.
Howdy. Oh goodness, those lights are bright. It's good I'm partially blind. Otherwise, it might blind me further. Good morning. Thank you so much for joining us for our panel today. We're going to be discussing disability data justice in global contexts. We are so excited. This is a fabulous panel, and we all love talking about disability data, especially through the lens of data justice. And so we're so excited that you're joining us today to have this conversation. And I'm going to just go down the row and have everybody introduce themselves. I'll start with myself. I'm Dr. Kate Caldwell. I'm Director of Research and Policy for Northwestern Law's Center on Racial and Disability Justice. I'm going to hand it over to you, Rylin, to introduce yourself.
Hi, I'm Rylin Rodgers, and I'm the Disability Policy Director at a little tech company you might have heard of called Microsoft, where I get to spend a lot of time thinking about data and how we're using it in a variety of ways. For a visual description, I'm a middle-aged white woman with brown and white hair wearing green and blue.
Hello, I'm Elizabeth Lockwood. I'm the UN representative for CBM Global Disability Inclusion, where I focus on disability rights in sustainable development, and one of those areas is disability data. I'm also a middle-aged white woman, 6 foot tall, brown curly hair with a leopard jacket and red shoes.
Hi, and I'm Bonnielin Swenor. I am the founding director of the Johns Hopkins Disability Health Research Center. I'm also a professor there, an epidemiologist by training. And the center is focused on using data to advance equity for people with disabilities. We are grounded in this principle of disability data justice that I know we're going to talk about today. And my visual description is I'm also a middle-aged white woman with long blonde hair, always forget what I'm wearing a light white top and a dark suit, and really happy for this conversation.
And this is Kate again. I guess I forgot to do my visual description. I am middle-aged, getting there. A white person, female presenting, I guess, with a disconnected undercut that is slowly going sparkly and gray, and glasses with a purple blazer and blue shirt. And also I will mention that you'll notice on the screen that there's a QR code, and you can actually use that code to access the slides for today, as well as some resources we're going to be sharing at the end. And because we weren't sure whether we would have enough time given the constraints for questions, we wanted to provide an avenue for asking them. So there's also a form where you can ask questions and we will respond to them, even if it is after today's presentation. So the way that you use a QR code is you point your camera at it, and your camera will open up a link that you will click on. All right. So let's get into this discussion. We have several questions, 3 questions in particular that we wanted to talk about. The first is, what exactly are we measuring when we are measuring for disability? And let's start on the other end. Let's start with Bonnie.
Oh, okay. So this is such a central question, and I'm glad you're asking it because I don't think we ask it enough, right? What are we really measuring? And so the way I was thinking about this question in preparation is there's a separation between what do we want to be measuring and what are we actually measuring, and then the context in which we are collecting that data or wanting to use that measure. And so in the work I do and in the work in disability data that I've done, I've really focused on there is a separation between what I think we often want to measure as the construct of disability, to estimate the total number of people with disabilities in a community or in a population, and the actual questions are the measures we're using. Those questions tend to really focus on functioning or difficulty with functioning, which are important information, but they themselves are not actually defining a population of people with disabilities, right? They're overlapping constructs, but not exactly the same thing. And so I think that when we're hoping to measure disability, to be honest, I think we've got work to do. That's the first thing in getting to better measures. that better represent our diverse community with a diversity of perspectives and people that identify, people that don't identify even. And to be fair, I think the construct itself, we need to advance. The current idea of disability that measurement has been built on is a bit old, and social movement has happened. So it's hard for me to give a solid answer to that question because it's still a little squishy and evolving, but I think for me, we've got work to do on that area for sure.
Great. Building on that, I work with a lot of countries and look at their disability data. And what we find is there are many, many gaps. And one of the gaps is the intersecting part of disability data. So I want to provide an example from a project that we as CBM Global funded with our partner, the World Federation of the Deaf, on access to healthcare for deaf indigenous women in Bolivia. And this was citizen-generated data, deaf-led data, and we found new data that had never been discovered before. I mean, these were a really intersectional group left behind, and this was data from this year. So I'll just give brief examples of the findings. The majority of these deaf indigenous women were raised by hearing families with no sign language in the home, so it had complete isolation. The women had increased poverty rates, lack of access to education, and higher risk of stigma and discrimination because of their intersecting identities. They also were based in rural settings. The women had no access to sexual and reproductive health education, and as a consequence, unintentionally, many got pregnant. Pretty shockingly, all of the deaf women interviewed were victims of rape and/or sexual abuse. And this was from family members and intimate partners. And even more shocking, the women, many did not even know this was abuse until the interviews themselves. And then finally, the main barrier in communication was lack of access of sign language interpreters in healthcare settings. And so these women would have to bring their family members to be interpreters, and often these were their abusers. So it was a violation of privacy and double victimization. So this is the real importance, this citizen data that we gathered, now we can use as evidence to advocate policy change at the government level. Thank you.
So I love this conversation because it makes me think about the ways that we think about disability data in my life and my work. I work on disability policy, and often the question comes up about race and identity because it is the force to push policy change. And most frequent question I get around data is, when are we going to have some new data? Because when you think about like the rates of disability in the world, for a long time, we've sort of had this general, I think you said mushy, concept that, maybe it's 1 in 4, but then if you dig a little in the US, you see, 1 in 4 people often identify with a mental health disability. So it's got to be more than 1 in 4. And why don't we have good data? And what does that mean? And if we don't, how can we create good policies? So that's an interesting piece. But I also love the discussion about the different types of definitions. We've previously looked at sort of diagnosis, which is more of the medical model of what label you carry. And now we have different constructs of social identity. And I think about that in some of the employment data. We're here to talk about employment this week. And I'm part of a company that has the opportunity to self-disclose your disability identity. And the question is, do you have a disability? Period. It doesn't ask what type. It doesn't say what disability means. It's up to me as a disabled person to say, yes, I do, and to know what that means for me. And that leads to really fascinating conversations, because some people who are maybe on the cusp and there's like, I live with chronic cancer, can I say yes? Am I allowed? And so we have that discussion about inner justice frame and what does the ADA protect? And that's the concept of disability as anyone who can be discriminated against based on it. And that certainly counts, chronic cancer. And so it's this really mushy place, but it matters so much because when I think about it in the employment sense, it drives my company that we actually have a growing percent. We're working hard to have even more because we need that talent. But then our benefits, frankly, get better for disabled people because more of us are there. And they say, what do you need? What do you need in terms of a personal care attendant? What do you need in terms of a sighted assistant? And it becomes part of the culture because the data drives it. So it's a mushy mess, but it's really important to get it right.
And I would say, so far, thank you so much. I think that segues sort of nicely into what I was saying, especially picking up on the intersectionality piece that several of you spoke about. At our center, what we're really doing is looking at the intersection of race and disability and everything that comes with that. You can't really talk about that intersection without also talking about gender and class and LGBT status. And so one of the things that I always keep in mind when we talk about how are we measuring disability and what exactly does that mean is that the way that we measure disability was not created by disabled people. It was created by non-disabled people who were seeking to prevent or somehow fix or eradicate disability entirely. It has very eugenic implications. And it's important to understand that data is actually a tool of power and that data is not neutral. A lot of times we like to think quantitative data is objective, but it never really is. It relies on ableist, racist, classist, ageist, social systems, and it can also serve to perpetuate those systems as well. Sorry, I'm referencing my notes. A lot of the data collection algorithms and governance that we have can reproduce systems of oppression, particularly along the lines of race, gender, disability, and class lines. And often it does so in ways that maintains the power of dominant groups. And so in order to actually create disability data that is just, that is equitable, and that is representative and reflective of the disability community, what we need to do is we need to have more grassroots approach. And that's at every single level of data, right? From collection to analysis to reporting and dissemination, and access and accessibility at every stage as well. In particular, even if we look at the methods that we're using to collect disability data, there are intersectional methods that exist that we have not been using that can better serve us in this vein. And so it really is bringing disability data out of the, I was gonna say dark ages, but eugenic ages and into where we are now in our discussions around disability. Thank you so much. So our next question is, what is the role of data justice, specifically in disability? And I feel like kicking it down there to you again, Bonnie, if that's okay.
Sure, this is Bonnie. Yeah, so, I think this question gets at this principle of disability data justice, and so maybe I'll just quickly address that. And so at my center, we think of disability data justice as using data to redress the harms that have impacted people with disabilities. And recognizing what Kate just described of how powerful data are, and data are not agnostic. And it matters who collects the data and the methods that are used to collect the data and how we analyze the data and how we share the data and the power imbalance that can happen across the entire arc of that process. But also a great opportunity to address injustices if you crack open that process in ways perhaps that we haven't thought about before. And so I think the role of data in advancing disability justice is both amazing, underutilized, but also essential. And it's this idea that I think Rylin was also getting at, is that to make change, to make evidence-based policies, we need the data and we need the evidence. And that is really this principle of using data to uphold and push forward disability justice. It would be wonderful if we didn't have to prove it, right? It would be wonderful if we didn't have to show up with all the data and people would get what we're talking about and asking for. But that's just not the world we live in. And so, I think that data is essential for driving that forward and upholding accountability.
Great, this is Elizabeth, and I work in all my advocacy with organizations of persons with disabilities. I work with them, and we are partners in all of this. And one of the things we've been really focusing on at the UN is working on citizen-generated data, or citizen data, which the UN likes to call it, to ensure that gaps are filled, because many national statistical offices are actually asking for this for marginalized groups, including persons with disabilities. So we're engaging in this process, and I think this is a very important process to recognize, and OPDs need to be leaders, co-leaders of this process from the very beginning through the whole data value chain or data value cycle. And we work on advocacy in the Sustainable Development Goals, and actually out of 231 global indicators, only 3 can be disaggregated by disability, so this is really quite important. But we have found that there are global disability data, but policymakers and statisticians aren't talking to each other, so it's not being shared. So we want to convene these groups to really share the data that are there, that are available. We also find that governments aren't always interested in disability data, so we need that political will. For a variety of reasons, they aren't interested, so this is something we need to push. And also, there's lack of data capacity for national statistical offices in many cases, especially low-income countries. So this strengthening the capacity is quite important. And OPDs can do this. We have tools like the Disability Data Advocacy Toolkit and workshop that we've developed that are very important, and we know prevalence increases with awareness. This is quite important. And also, it's not perfect, but we do recommend the international comparable tested and methods of the Washington Group short set for censuses and surveys and the child functioning module with UNICEF, because it has been used in 125 countries and the UNICEF's in 60 countries. So we can compare internationally, which is important, but I know it has its flaws as well. And I will
She looks at me.
We'll finish there.
I think we all looked at you, Bonnie.
It's okay.
When I was thinking about this, and we didn't talk about it then, but I've thought about it a lot since, it really took me back to the reflective work that I was doing during the COVID pandemic, the early parts of it. And in that period, I was really spent a lot of time thinking about how do we learn these lessons and not repeat them. And at that point, what was happening, as we all know more transparently now, is that disabled people were dying at disproportionately high rates, and nobody was paying attention. And it was horrific. It was keep you up at night, shake your soul, horror, scream from the mountaintops in your Zoom box, horror. And I think a lot about that in terms of where is data and disability justice. And the reason that people weren't paying attention to those high rates is that people weren't tracking disabled lives and where disabled people were and what the risks were. It just wasn't part of the conversation in really wealthy countries and in other countries. And so when I think about that experience and what we should know now and be significantly better at as a world, but aren't yet there, it to me is a tremendous failure that we haven't embraced that horror and made giant steps forward. Because in order to be part of our integrated social world, we have to be seen and known, and in many systems that means there has to be the data so that our needs are represented when there is any type of crisis or challenge. And we have failed at that, and we continue to fail at that.
Thank you so much. And that's so hard to follow as well. But I also want to sort of highlight that one of the things anybody that works in disability policy knows is that disasters and pandemics and all of these things, they tend to hit the most marginalized communities, the most disadvantaged communities first and hardest. And a lot of times we talk about how disabled people are the canary in the coal mine. And Alice Wong talks often about how disabled people are oracles, because they can tell you what's going to happen before it happens, because it hits our community first. And especially for those that are in multiply marginalized identity categories, they're going to hit them first and hardest. But we aren't listening to those communities. We aren't collecting data. They're considered statistically hard to count communities. And sometimes that's used as an excuse not to try as hard as we should be to count those communities. But there's power in being counted. And so one of the things that I think is really critical to what we talk about with data justice, especially disability data justice, is how do we incorporate racial justice into this discussion? Data systems often erase or misrepresent disabled people, especially disabled people of color, and this leads to exclusion from policy, from healthcare, education, and employment opportunities. We know that there is bias in algorithms and AI tools, and that this compounds the harms done to these communities as these systems amplify both racism and ableism, and they tend to reinforce them. We also see that there is surveillance, and we see a certain amount of surveillance, and in the criminal justice system, it disproportionately targets and penalizes disabled people in marginalized and racial communities. And when we're thinking about how to move forward in all of this, the solutions are going to require a deeply intersectional approach in order to actually reach something like justice. And it's going to need to be data justice that centers disabled voices of color. It's going to need to be one that addresses systemic inequities and promotes inclusive, accessible, and equitable data practice at every single level. And that's not an easy task, but it doesn't mean that it's not achievable. And so that sort of leads to our next question, which is actually my favorite question. So I kind of cut my answer a little short because I want to spend more time on this one. And that is, what are the benefits and drawbacks that you see in advancements in technology in the work that you do? And I don't want to pick on Bonnie again, so I'm actually going to start with Rylin, since you're at a small tech company.
Teeny tiny. I'm glad you all are learning about it. So I actually love this moment because it's incredibly interesting. You know, the world of AI is built on large language models, which is data, it's information, and it's built on the world as it is. And we all know that the world as it is racist, it is sexist, and it is ableist. And so that is an unbelievably complicated challenge about how do you build and deliver technology in a way that does not increase or disproportionately share that, but instead starts to rebalance it. And so there's several things that I think are kind of exciting, because it's actually a force of change to say we have to have better data or the technology won't work well. And so we have these amazing conversations about where are the data gaps. You know, one is in the way that technology takes in speech information, whether it is speech information to turn on and off your lights or create captions. It used to work pretty well if you didn't have typical speech. And then as the data models got more normative, it started to be crap if you didn't have typical speech, if you had speech that was impacted by types of disability. And the way to fix that was to get tons and tons of data of disabled speech patterns into the data models. And that's taken collaboration with the disability community to do it across models of Parkinson's and Down syndrome and cerebral palsy to really get those models to start to work so that everybody can say, Alexa, turn on and off your watch. I just probably turned off somebody's watch, so sorry. But whatever we need to do in those spaces. And so it's been an interesting thing to see those data stores get bigger again and what happens. The other thing that is really interesting is we're missing data that's created by disabled people. So I am not, thank God, in charge of the business side of Microsoft. That's probably why it's doing all right. But they have recently had a big deal where they bought tons and tons of data from a company called Be My AI. And it was all data that was voice, video, pictures that was created by disabled users. And the reason they bought tons and tons of data is that the AI models get better when it has disabled created data integrated into it. So those types of things are cool. And then the one other thing that I think is super cool, but has to be part of the transparency conversation that we're all having, is there is an ability to red team your model or train it in a way that addresses the gaps. So we know X, Y, and Z factors of humanity are dramatically underrepresented. So you can take that information and then retrain the data to make it a more equitable representation. So if you have a medical study that's targeting something of a rare disease or syndrome that only exists in 0.1%, you can take a small data set and then replicate it using a larger model to get a better representation. And there's some chance there to get to the scale of better data, but it has to be in the model. And if we're all interacting with models and somebody didn't train it to account for who's left out, we're not going to see that benefit. And I'll stop talking about nerdy stuff.
Yeah, please.
It's Elizabeth. I'm going to use two examples from research I've done with global organizations of persons with disabilities. Oops, losing my notes. The first one is research we did during the COVID pandemic, so that's very nice to build on that, with International Disability Alliance. And we wanted to get data on persons with disabilities and their experiences because there were no data and that we could find. And so we collected data with OPD leaders. And one of the things we found was a very large digital divide. And many persons couldn't access their cell phones, they couldn't pay for programs, they didn't have fast internet. And then very interestingly, the deaf community, they didn't have captions and they didn't have sign language interpretation in their daily news briefings. And what we saw turned out was OPDs and deaf associations advocated, and in the case of the captioning and sign language, advocated to get this added, and in many cases it was added, not universally, but we see that some of it has remained for emergencies today. But I will note that there are many barriers, this is not perfect, but that is an interesting example. And also working with the UN during COVID, I live in New York City and stayed the whole time. The UN was great. They were all into accessibility for online platforms during the pandemic. And then when the pandemic lessened, they stopped. And that was a real shame to me because it was not affecting the general population anymore. And that's a real shame, which I have voiced many times. And then the second example, I am a member of the World Federation of the Deaf's accessibility group. My background, I grew up with deaf people, that's why I have a lot of deaf examples here. And I wanted to share their feelings around AI and sign languages very briefly, because this is something that keeps coming up. We get asked a lot of questions about signing avatars. And the problem with this is it's usually almost always developed by hearing people, and it's one-way communication, so the avatar is signing, but then the deaf person can't respond. And the WFD is worried that this will ultimately replace live sign language interpreters. So they are setting up an ad hoc committee to create a position paper on AI and sign languages. So I think this is something to really look for. It's coming soon, and they have a conference in Kenya next year where it's a sub-theme. So I think that's something to really look for and to keep in mind, and I will finish there.
Oh, this is Bonnie. Well, since we're at the Harkin Summit, I'm gonna talk about what I think is an opportunity for the workforce in relationship between data and AI and people with disabilities. And what is either a barrier or a challenge, depending on how you want to look at it. But I think to address and to think about all the things that have been discussed. We need more people with disabilities working in data science, working in AI, working in positions like my colleagues here on stage, because we can't just be the data, right? We have to drive change in developing the algorithms and developing the checks and balances, you know, on the red teaming to see where and when things are going off the rails. And that's a workforce issue. And to be honest, and I think Kate has referenced this, you know, there's so many barriers to that still, right? The challenges to just get the education needed to have those kinds of jobs, the inaccessibility in those processes, the bias, and then the inaccessible tools to even do the job and the biases in those jobs. So to me, I hope that this new frontier creates a demand for a workforce that then helps people with disabilities be better included in the development, in meeting this goal of creating a future with technology that is for everyone and by everyone. We will see if that happens or if we just repeat the past, but I think the workforce is essential to getting us there.
Oh, thank you so much. And yeah, I will. So we actually have some extra time, so I'm gonna pick up on something you said. I think, you know, disabled people are the largest job creators and contribute substantially to the world's economy. And they have the potential to contribute to the workforce in powerful ways in so many different capacities. But that also reinforces concerns around things like algorithmic bias in AI hiring tools that may pre-screen in ways that exclude disabled applicants, in similar ways that it excludes people of color. It's been a long and wonderful conference, but my brain is slightly jelly. So what I wanted to really focus on here in my response is that there's so much promise in technology. And I think most disabled people want advancement in technology, especially if it's going to help them in their life in some way. And sometimes that means advances in technology that leads to treatments that will help them, you know? And a lot of times people think, oh, if you're a disability rights advocate, then you don't want your disability treated. It's like, no, I don't want it prevented, and I don't want genocide or eugenics, but I do need treatment and supports and services and all these things to live the best life I possibly can. But for communities of color and disabled people, and especially disabled communities of color, there's a double-edged sword that's posed by data and the process of data collection, because of the way that research has caused harm to those communities, the ways that it has led to erasure, neglect, exploitation, and even abuse in the name of research. And so there's a healthy skepticism. And I'm thinking very much about the conversation during the last census collection around immigrants and refugees that became sort of a political talking point. And there was a lot of advocacy done, especially towards disabled immigrants and refugees, trying to ensure that there would not be an undercount, because data is power, the power of being counted and having your voice count. But also undercounting leads to underfunding. It leads to a lack of resources in your community, and it can really damage local and state economies in really important ways. It can lead to fewer representatives that are representing you and their constituents, or assuming that their constituents are different than who they actually are, right? And so it's this compounding system of oppression that actually happens. And so in that way, it creates this double-edged sword. So discussions around security integrity, data security are essential. And so, Rylin, you were talking about, these databases, the larger they get, the more accurate they get, but there's also a lot of people who are worried about the privacy of their data. And, sometimes these companies, their data is bought and sold, and people don't realize, oh, I clicked that box when I signed up for that app, and now my data belongs to them. What does that mean for me now? I know 23andMe is having a huge issue around that right now, with people worried about their genetic testing material being possibly sold, as that company is facing some difficulties, right? I think also we need to acknowledge that technology is a normalizing agent, and that's unavoidable. It is also a method of surveillance by its very nature. And on the one hand, we want that because we need that in order to count and be counted, but on the other, we have to realize that it has the potential to be used in ways that cause harm, that perpetuate oppression instead of in liberatory ways. And so, as I think Rylin mentioned, it's finding that balance and what is actually going to make the difference between data and technology being used for good versus it being used in ways that perpetuate harms. I also want to talk about AI and algorithmic bias a little more. And despite the potential benefits of AI, and there are huge potential benefits, as someone with learning disability, I can see so many ways that I could possibly use AI to enrich my life. There are, however, a lot of concerns as well. I mean, starting with the environmental impact of AI, but also it can deepen inequities and discrimination facing marginalized groups. And the bias exists in underrepresentative data that's used to train the AI, as well as algorithmic bias in how it's being analyzed. And it occurs in how data is labeled during the model training. For example, in pretrial risk assessment algorithms, this bias can actually reproduce and reinforce existing biases that disadvantage people during those moments when they really need support and to be able to access their rights under the law. At the end of the day, it is actually a legitimate threat to our civil rights, and it has the potential to widen economic and health disparities, and certainly employment is a large part of that. As I know I'm preaching to the choir here, you all know that health and employment are very much interconnected. However, what can be done in order to try and advance this in ways that are going to be productive and liberatory and really benefit our diverse disability community is looking at it through a disability data justice lens, one that is deeply intersectional, and moving beyond an overly simplistic view of data or AI fairness and towards a lens of a disability data justice. And we have a couple minutes left. One thing I do want to highlight is that we've included some resources on our slide. We've each listed some resources. I have some from the Center for Racial and Disability Justice. We're going to have a brief coming out on artificial intelligence soon. I want to give the other panelists an opportunity to hype their work. Don't worry, Liz, yours is on the next slide as well. Bonnie, is there anything you would like to hype?
No, thank you.
You're hype enough, that's fine, that's good. Rylin, is there anything you would like to hype?
The one thing that I would point to is I think there's incredible value at looking at the companies who are doing this work and what standards they're using in terms of ethics. We have ethical AI standards in terms of how we're implementing, and they've evolved over time based on feedback and learning. And I think that's a key part of the conversation, particularly in places where there's not yet regulation. So having that transparent conversation and look, and also thinking about that in terms of procurement. When you're choosing what to buy or use, really looking at what the standards are that provider is using to design the system, because there are differences. And I think that's a fair way to increase your awareness of how this all works.
No, I don't have anything to hype about my work, because that's, yeah. But I think that we need to, in general, just do a better job as a researcher, as an academic, in having these kinds of conversations outside of ourselves. So thank you to Kate, because Kate put this panel together, and I think this is so important. So I was going to say no thank you. I would rather hype.
Oh, thank you so much. I'm so glad that we're all here. I'm excited. And thank you all for coming. And thank you to the interpreters who are amazing. Liz, please, hype yourself.
Just 2 points. One, all the pieces we put together here were done with OPDs in the lead. I think this is really critical. And then the workshop is facilitated by OPDs always, and that's been very successful. So in Lao, for example, Lao PDR, we had the Laotians leading it, the OPDs leading it. So we translated for the countries we're working in, for example. And then I have a question for you. Part of the UN Collaborative on Citizen Data, we're putting together a guidance note on intersectionality. So if you have any examples, please share them with me. I want to add them. Thank you.
Fantastic. And we are exactly at time. Woohoo. Thank you so much to everybody. You've been wonderful.